The third presentation is on knowledge on symptoms, transmission and treatment of pulmonary tuberculosis, a single center study. The authors of the presentation is B. Seneviratne, LAM Gunawardena and WRIS Kumara. The paper will be presented by Dr. Bimalka Seneviratne, Senior Lecturer, Faculty of Medical Sciences, University of Sri Jayawardenepura.
Good morning, Chairperson, ladies and gentlemen. My topic is knowledge on symptoms, transmission and treatment of pulmonary tuberculosis, single center study. We all know tuberculosis has been a dreaded disease in Sri Lanka for centuries and still continues to be a major public health problem. It is an infectious disease caused by Mycobacterium tuberculosis. Although there are less common species, this is the most common species. The disease most frequently affects the lungs, although again it can involve any organ or system in the body. About 8,000 new cases of TB are notified every year, of which approximately 55% are smear positive pulmonary tuberculosis. Case detection rate has increased to 88%, but the default rate still remains at 60 to 70%. This is on par with, according to the National TB Program in Sri Lanka, the statistics. Tuberculosis has classically been associated with poverty, overcrowding and malnutrition. Low-income countries and deprived areas in developed countries present the highest TB incidences and mortality rates. These are settings where immigration, social inequalities, HIV infection, drug or alcohol abuse coexist. According to a recent WHO report, there has been a decreasing trend in the global number of TB cases since 2006. In 2010, again according to WHO statistics, there were 8.8 million new TB cases and 1.5 million deaths due to TB. Objective of our study was to assist the knowledge on symptoms, transmission and treatment of pulmonary tuberculosis among the patients and their relatives who visited the outpatient department at the Colombo South Teaching Hospital. It was a descriptive cross-sectional study done at the Colombo South Teaching Hospital. The study set up as the OPD. Study population was the patients and their relatives, and a systematic random sampling method was used. And prior to the test, the written consent was obtained from all the participants and data was collected from the pre-tested interviewer-administered questionnaire. Data was analyzed using the SPSS16 version as the analysis tool. Descriptive statistical methods were used to describe and summarize the sample characteristics. T-test was used to identify the statistical significance of the association between the two variables. P-value less than 0.05 was taken as the level of significance. These are the demographic characteristics which we found from research. The gender, the total study sample was 384 cases, out of which 218 were females, amounting to 56%, and the males were 43.2%. Age categories I have given below, and the highest proportion was in the 19 to 30 age group, 32.8%. And this was the education level. And again, the highest proportion, 39.8, went up to an education up to GCE advanced level. The income level, we had to give a percentage mark, and according to the distribution was divided into three groups, and this was the low income, moderate and high income groups. And 60.7%, that is 233, fell into this low income category. And this was the distribution of the occupation. There was 6 groups: unemployed, government, private sector, merchants, retired people and self-employed. Again, the highest proportion, 36.7, were in the private sector. They were private sector employees. Knowledge again with the percentage mark was divided into 3 groups, the poor, moderate and good. The 56.8 had moderate knowledge about tuberculosis. Symptoms of tuberculosis, a very important question. It's important to be aware of the symptoms, to take preventive measures or plan for treatment. Prolonged cough, one of the most common symptoms. Again, 93.8 knew that symptom. They answered yes, 360 out of 384 participants. Coughing out blood, 62.0% knew about it. Night sweats, not much. Low-grade fever, 39.1%. Weakness, lethargy, 44.5%. And weight loss, 40.4%. Symptoms, how they answered, knew about symptoms of tuberculosis. Then the questionnaire with regard to curability, the causative organism and transmission of tuberculosis. Curability, yes, it was very satisfactory. 95.8 knew that it can be treated. And causative organism as a bacteria, TB is a bacillus, not much, 39.3. And involvement, the distribution in the body, the lungs, about 88.5% said yes. Again, then HIV as a risk factor was not satisfactory. That association was not known. Only 45.6 answered yes, the link between or the risk factor HIV and tuberculosis. Spread from person to person, highly satisfactory, 92.7 knew that. And inhalation as the most common route of spread, again, was satisfactory results. Transmission from mother to fetus was not that much. 39.0% answered yes. It was not known to the majority. Diagnostic tests for tuberculosis. Sputum test, 74.2% yes. And it went down when we asked about blood test, X-ray and urine. Preventive measures, again, was satisfactory. Improvement of living conditions, BCG vaccination, good health habits, isolation of patients, and completion of drug treatment. And this is how they answered with regard to preventive measures of tuberculosis. Knowledge on the treatment plan of tuberculosis, it's again very important to cure patients and minimize the spread of disease from person to person. When we asked about best treatment, yes, 94% accepted that Western medicine is the best treatment. And when we asked about recommended treatment, again we got satisfactory findings. We had a questionnaire about reasons for not accepting recommended treatment. And yes, it was inadequate knowledge, 262, that is 68.2% said, and traveling problems, 35.7%, and 34.1% due to lack of time, and 39.6% said financial difficulties were the main problems that they faced in getting treatment. Duration of the treatment, again that's an important aspect in the management of tuberculosis, is the completion of the course, full TB course. Few days, few weeks to several months. 86.4 said it goes on to several months. Then about the continuity of drugs, 72.7 said you have to continue the drugs even when the symptoms resolve. Conclusion. Other than gender, profession and age, other demographic variables like education level, monthly income had a statistically significant association with the category of knowledge. These findings were similar to a study done at the Faculty of Medicine, Gaul, about 5 years ago, and also an international study done in Metro Manila, Philippines, and in the Punjab state of India. Majority knew that the tuberculosis is a curable disease. The knowledge on routes of transmission and preventive measures was satisfactory. High percentage of participants knew about the symptoms of TB, again a very important aspect in the treatment. But awareness about HIV infection as a risk factor for TB was poor. The existence of a good TB prevention and control program is essential to fight against tuberculosis. The coordination among clinicians, microbiologists, epidemiologists and others, and the link between surveillance, control and research should always be a priority for a TB program. Each city and country should define their needs according to the epidemiological situation. Local TB control program will have to adapt to any new challenge that arise in order to respond to the needs of their people. Thank you. Sorry, I took 1 minute more, I think. Sorry about that.
The paper is now open for discussion. Any question?
What sort of a clinic setting that you have?
This was the general OPD. We rather than picking from a clinic, we visited the OPD at the Colombo South. We wanted general impression rather than picking. We thought it will be the disease will be cured, and yes, and the patients and also their relatives who were here.
And the income groups. And how did you categorize these three income groups?
That was done by the department based on all the findings. It was statistically analyzed and put into 3 groups, and statistical advice was from the Department of Statistics, University of Sri Jayewardenepura, and also the Department of Community Medicine. They gave a percentage score and took the distribution and spread into 3 groups. Since it was the general population who was visiting, we didn't ask much about the drug resistance. We thought we'll touch the common problems that they would be able to answer. Sorry, we didn't include that. Maybe we hope to expand this. We'll think about your question and include. Okay, Thank you very much.
Any more questions?
Can I ask a question? Now, you asked about chronic cough.
Yes.
What is the duration you specified for cough?
Chronic cough goes on for more than 3 months. A continuous cough for more than 3 months was in most of the literature they are continuing for more than 3 months is taken as a chronicity.
Okay. The National TB Control Program actually requests people to come if they have cough for more than 2 weeks.
2 weeks.
Yeah, that's the
definition of chronic is, I suppose, specifically for TB, what you are telling is right. Yes.
TB Control Program requests anybody who has persistent cough for more than 2 weeks.
2 weeks, yeah.
They are playing on side of...
Yes, they are thinking only of T. Yeah, I suppose that's right. There's a point.
Okay, thank you.
Thank you.